An important part of doing any research is how do you appraise the research that has already been done. This week we're looking at qualitative research, and I want to give you just a few quick tips, and then you will find more detailed information on the learning management system. First of all, before we finish this, I want you to understand the role of critical appraisal in research and evidence-based practice. I want you to be able to evaluate the strengths and weaknesses of a qualitative study. And then finally, I want you to utilize CASP to assess a qualitative article. And I will post the CASP document that I specifically want you to use on the learning management system so that you will have access to it and be able to use it. And if you go to the website, which I will also provide a link to, there are some instructions on how to use this tool that I think that you will find helpful. Let's review a little bit. Qualitative research is very important in nursing because it helps us to understand concepts, phenomena, and culture. Qualitative research does not have a hypothesis, dependent or independent variables, complex statistical analysis, or definitive answers. It is not generalizable. It is, however, important to nursing. Even though it's considered to be lower level evidence for evidence based practice, it's important to understand uh, how we see the patients, how patients perceive the care that they are receiving. It allows us to see things from the perspective of the other person and not just our own. Why do qualitative research? I would suggest that you want to do it because it helps us to develop a theory or explore a phenomenon. And in nursing, it helps us to understand our patients and see the world from their perspective. Your textbook gives you a table that pretty much is a step by step guide to appraising qualitative research. It starts with the elements of style and asking the simple thing of was there sufficient detail to enable a critical appraisal? And is there evidence that the researcher has the qualifications, knowledge, and expertise to conduct the research? Is their title clear, accurate, and reflective of the topic? And this is, and I know that seems like a minor thing, but it's really important because one of the ways people find articles on a topic is one of the first things they see is the title. So does the title reflect it? And I know that you have all seen news articles that when you read the title and then you read the article, they are not related. And you wonder, why did they put that title there other than as clickbait? That should never be the case in research. Your title should always reflect what your study is about. The next thing is the statement of the phenomenon of interest. So you've looked at the title, and is the title clear and does it relate to the research you're doing about the phenomenon of interest? And is that clearly stated? When you first start reading a research article, even in the abstract, you should know what the article is about. It should be clearly stated right up front. What's the justification for using the qualitative method, and what are the philosophical underpinnings of those research methods? One of the things you'll find in your quantitative research is sometimes that isn't clear at all, but in qualitative research, it should always be very clear. You want to know the purpose of the study and what is the projected significance of the work to nursing. Now, you are probably going to find some qualitative research articles that come up in your search that are not nursing articles. And that's okay because research does not have to be done by a nurse to be relevant to nursing. There are many people that do research that is relevant to nursing that may be medical sociologists or anthropologists or historians. You need to always look at the ethical considerations. Is protection of human subjects addressed? And it should always say that it was addressed and the status of that. So did the authors address IRB approval? Were the participants fully informed of the nature of the research, and did the researcher address participant autonomy and confidentiality? This is usually all stated in a few very brief, very succinct sentences, and you will find the same sentences in many, many articles. Then the methods. Is the method used to collect data compatible with the purpose of the research? And is the method adequate to address the phenomenon of interest? As you go through these, remember that it's always easier to do this if you have a sample article in front of you. I mean, your textbook gives you an example, and in fact, it gives you an example. It tells you what the article is, and then it does an entire analysis of that article. That is, if you will notice, their analysis was almost as long as the article. And what I'm asking you to do is actually fill out a form that walks you through many of these same things without doing the write-up. So you're going to fill out the form and answer the questions within the form. Sampling. What type of sampling is used, and is it appropriate given the particular method? Remember, qualitative research doesn't use randomized controlled trial type of sampling. Are the informants who were chosen appropriate to inform the research? So if I'm doing the views of nurses about COVID-19 and care of the patients, then it's going to be need to be nurses that cared for COVID patients. I wouldn't want to interview nurses that had never cared for a COVID patient or had any potential of doing so. Were the participants and setting adequately described and appropriate for informing the research? You should be able to read the article and know what the setting was and who the participants were and any inclusion or exclusion criteria, and then was saturation achieved. And they should tell you how they did that. You want to look at the data collection methods, and you can walk through these that again go back to, is saturation of the data described, and what are the procedures for collecting the data. And then most likely you're going to see something about recording it, and you're going to see something about how those recordings were transcribed, and then probably something about the types of tools they use to identify the themes. In your data analysis, what strategies were used to analyze the data? Has the researcher remained true to the data? I think that that's frequently hard to tell for articles, and certainly at your stage, I think that that would be hard for you to determine. Is there logical connection between the raw data and the themes? And again, that's going to be hard for you to tell because you're not seeing the raw data. And does the reader follow the steps described for data analysis? And then finally, the authenticity and the trustworthiness of the data. So does the researcher address this? And you want to make sure that they are credible. And you can walk through all of these steps to make sure it was credible. Um, but one of the important things is that there needs to be credibility, there needs to be an ability to audit what they did, and it needs to be transferable. And then finally are the findings presented within context. Is the reader able to understand the essence of the experience from the reported findings? In many ways, this is saying, did they tell a good story that you could follow? And then you always want to end your research articles with the conclusions and the implications and what needs to come next in terms of a study. If you have questions about how to do this and what I'm asking you to do in critically appraising a qualitative article, you can join me for office hours via Zoom and I can discuss it with you further. Remember to look on your learning management system page and you are going to find the specific CASP form that I would like you to use for your critical appraisal.